Okay, we're going to start now. Welcome, everyone. Thank you for joining us for today's webinar. My name is Luis Mares, and I am the Community Mobilization Director here at the Latino Commission on AIDS. Today, we have A4AIDS here in the house to make a webinar, present a webinar, Venezuela HIV and Humanitarian Crisis, presented by its Director, Jesus Aguais. Just a little housekeeping before we get started. If you have any questions, please write them in the question box in your ReadyTalk control panel, and I'll bring them up during the presentation. And we will also have time for questions at the end. I have muted everybody to avoid noise interruption, and also this webinar is being recorded, so it can be shared later with those who couldn't join us today. Our presenter today is Jesus Aguais. Jesus is an AIDS activist, former member of ACTAP, founder and full-time executive director of A4AIDS since 2007. So without any further ado, we will turn the floor to Jesus. Welcome, Jesus.
Thank you, Luis. Thank you so much. Let me walk you through the agenda for the next 20 minutes. So I'm going to start with a background of A4AIDS and our success story, what we have done in these past 20 years. Then we're going to go and focus on Venezuela, on the economic situation that is so difficult right now, how that affects the overall healthcare crisis. And then we're going to dig into the HIV crisis in Venezuela. We're going to continue on what are we doing at A4AIDS to help the people in Venezuela. And we'll continue with a call to action. What can you do to help? And we're going to finish with a Q&A. So a little background, as many of you know, in 1996, two protease inhibitors came out in the market. That was Saquinavir and Norvir. And that was immediately translated into great improvement in the health of people with HIV here in the US and some European countries where there was access to what we still call the cocktail, the combination therapy. But we all knew that was millions of people around the world without access to treatment. So I'm originally from Venezuela as well. I moved to New York in 1996. I'm in 1989, and in 1996 I was working at St. Vincent Hospital at the HIV clinic, and there I saw what was happening. People were switching. People who started combination therapy with Saquinavir some people developed some set of side effects and want to switch with people that added ritonavir at that time. So me and a group of friends decided to start A4AIDS. It was a continuity of the activism that we started doing in late 80s and early 90s. And the plan was to use this medicine when people switch this surplus medicine that was ending up in the garbage. So we started, and we call it recycling. That process of getting the medicine from the patient, from the person, and sending it to people in developing countries. Of course, we added HIV prevention and education from the very beginning. So we call the HIV recycling program. It's the process of gathering, sorting, and use HIV medicine from people in the United States and send it to people in developing countries as humanitarian aid. With the uniqueness of the program that people in developing countries get enrolled in our program. We work with physicians in each individual country worldwide. We knew at the time that we were not allowed to give this medicine to people in the United States. So it worked out to support people abroad. So we started recycling all kinds of antiretroviral therapy, including opportunistic infection medications. And the medicines come first from people with HIV and from organizations, community-based organizations around New York City and then expanded around the U.S. You know, individuals, groups, collectors, like the LGBT Center, our internet campaigns, and the drop-off boxes that we have around, especially in New York City and some places in California. So, this is technical issues here. Here we go. And what we achieved on these past 20 years is that we've been able to save over $130 million worth of HIV medicines to support on treatment 20,000 people in 43 countries worldwide. In 2017 alone, we saved 7.3 million, which 1.6 million went to support people with HIV in Venezuela and allow us to support 400 people, give treatment to 400 people in Venezuela. And that's a big or small number, depend the way you look at it, but we are a small nonprofit in New York City, and for us that was a huge achievement. So what happened in Venezuela with this very dire economic situation? Let me give you a little bit of background. Venezuela GDP in 2017 was minus 12%. It's a runaway inflation with up 2,000%. Finally, in October 2017, hyperinflation was declared. With a growing unemployment, around 20% overall, for young people is more than 25%, and that put 80% of Venezuela over the poverty line, and almost 10% on extreme poverty. So families can hardly eat twice a day. Of course, this also translated into purchasing power plunge. For the past 3 years, the government increased minimum wage on a regular basis. In 2017, the minimum wage was increased 5 times, each time double digits. And again, I don't expect everybody to follow this. And on the Venezuelan currency, minimum wage is almost 800,000 bolivares, which is the Venezuelan money. But that translates into $3.49 minimum salary a month. Yes, a month, not a day, a month. So people are supposed to survive with $3.49 a month. So to put this under perspective, you could see the graphic on the bottom of the screen. And these are Venezuelan prices, all right? In Venezuela, if you buy a dozen eggs, it costs 90 cents. A gallon of milk is 56 cents. A kilogram of meat is $1.92. And a kilogram of rice is 79 cents. Just to buy that, you spend more money than what you make. So it gives you the perspective of how deep this crisis, this economic crisis is. So, as expected, an economic crisis translates into a health crisis. And we see that 85% of basic medications and medical supplies are lacking. There's no way to be found. Hospitals are hardly making it. Half of the operating rooms are closed. 3/4 of necessary medical supplies are no way to be found. Lab infrastructure, 97% of it is failing. For women that cannot breastfeed, there's 64% of shortage of baby formulas in public hospitals. Infant mortality only last year increased 30%. and at least 50% of children are suffering acute infection, and 54% of children in Venezuela have some sign of malnutrition. So how is this affecting people with HIV? In the latest UNAIDS data report, we can see that 120 people are reported living with HIV in Venezuela. And I put the word estimate in my presentation because that number is the number that they got from the Venezuelan government, which is known as being very unreliable, and it's data we cannot really trust. Civil society and service providers calculate that this number could be up to 300,000. The report also shows that 6,500 new cases of HIV are reported a year. But what we do know is that 77,000 people are registered in the National AIDS Program to receive ARVs from the government, which is the entity that should provide free antiretrovirals to the people in Venezuela. So 80% of these 77,000 people have been without treatment for the past 6 months or more. And there's another very interesting data that the latest report shows that 2,500 people have died of AIDS-related illness last year. But when we look at the numbers, that in 2012 and 2013, that was 1,300 people. That number has almost doubled. And again, this is all underreported. We don't really know what's happening. So this crisis is so profound and so deep that the crisis has layers. Among vulnerable population, we have even more vulnerables. And I'm going to give you 2 examples. The UNAIDS report shows that 2,300 children are living with HIV in Venezuela. But what the report doesn't tell you is that because there's no access to treatment, women with HIV with newborn babies are forced to breastfeed their kids because there's no baby formula and these women are not on treatment. Only 27% of women are taking antiretrovirals, and this number is from August of 2017. So women have to breastfeed their kids or let them starve to death because there's no baby formula for them. Another very dramatic situation is what's happening within an indigenous community in Venezuela. The Warao indigenous community, they are in northeast Venezuela. They're in a very remote, very difficult area to get. It's where the Orinoco River merges with the Caribbean. It's a beautiful place. It's paradise. There was a study in 2013, a prevalence study in 2013, that showed that 10% of the population was HIV positive. That was in 2013. None of them got treated. Today, this population can disappear. We don't know what the rate of infection is among this population, and no one is doing anything about it. I want to give you 2 close cases of the hundreds of cases that we get on a monthly basis. I want to tell you about Maria. Maria was 19-year-old. She arrived in our program when she was born from an HIV-positive mother. She was born with HIV because of her mother. The mother passed away when she was born. And Maria, when she was 19, already doing fine, had a baby. And lucky enough, the baby was HIV negative because of the medicine. And after she had the baby, she had postpartum depression, and she stopped taking her medicine. Because of the broken healthcare system, there was no support for her mental condition, and she died. She died 2 months ago, and Maria left a 1-year-old baby orphan. And then there was Alberto. Alberto is a 28-year-old that I didn't know anything about him until recent. He's the cousin of somebody I met when I went this past July to the International AIDS Conference in Paris. Her cousin is a Venezuelan activist who was outside the premises giving out flyers telling people about the health crisis in Venezuela. Of course, we connected, both Venezuelan, and we stay in touch. So her cousin called me 2 months ago saying, Jesus, my cousin Alberto is in the hospital in the south of Venezuela, in Puerto Ordaz. He was just diagnosed with AIDS, and he has TB. There's no medicine. Can you help? So we at A4H mobilized our resources, and we tried to send the medicine, but the government did not allow us to send it on a regular basis. And because we did not plan with our monthly shipment, that's how we get the medicine to Venezuela, it was almost impossible to get the medicine to the guy. We finally got it a week late, after all the obstacles that the government put in the way, and he was treated. Right after that, PCP, same thing. Government put us all type of obstacle for us to get the medicine just because it did not go on our monthly shipment. It arrived late. Then meningitis. We got the medicine from Colombia. The medicine got there late. There was none of these medications were available nowhere in Venezuela to treat any of these opportunistic infections. Of course, he died. He died 3 weeks ago. And this story really moved us to say we cannot stay silent anymore. This is what Venezuelans are living on a daily basis. But we at A4H, we haven't been that quiet. And we've been working on supporting the people in Venezuela for the past almost 2 years. So as you could see, out of the $7.3 million worth of medicine that we collected last year, 1.6, a big percentage, we dedicated it to Venezuela alone. But we've been also doing advocacy work among pharmaceutical companies. We were able, thanks to one of the largest pharmaceutical companies, secure HIV treatment for 2018 for 35,000 people. But there's still 40,000 people that needs medicine. We had sent, in 2017, we sent ciprofloxacin treatment for 70,000 people with STIs and other acute infections in Venezuela. The latest achievement that we're very thrilled is we secure malaria medicine, malaria treatment that will treat 350,000 people in Venezuela. We have delivered rapid tests that were able to be used in 11,000 pregnant women. But there's much more to do. This crisis is the worst crisis that we've seen in our continent for decades, if not hundreds of years. We haven't, at least for 100 years. This is a terrible event that is happening very close to all of us. So, of course, we have achieved all these things thanks to our partners. We have global partners. We have key strategic partners in Venezuela, and we have partners with the UN, around the United States that allow us to get medicine. And these are organizations just like our partner Latino Commission on AIDS. And this is when it's my calling. What can you do? We need everyone that is listening to join our efforts to support the people in Venezuela. And what we believe you can help is join us sending the message of our HIV recycling program. As I said before, $1.6 million worth of HIV medicine supported 400 people last year in Venezuela. We get constant applications. We have 200 people on a waiting list who needs treatment. But this medicine is the medicine that is in your client's file cabinet. This is the medicine that is on your own file cabinet. It's that medicine that you stop using, you won't use anymore because you would change treatment, and you don't know what to do with it. While we do advocacy work with other pharmaceutical companies so we can secure large donations of ARVs and OI medicine, the medicine that we have on our medicine cabinet can save somebody's life tomorrow. We at A4AIDS now learning with every day, we have become experts now on how to get the medicines in Venezuela. But what Alberto's story taught us is that we cannot wait for people to ask for the medicine. We need to make sure that the medicine is with our allies in Venezuela so we can get it into the hands of people faster. For that, we need to collect more medicine. So I invite you to raise awareness about this issue. I'm not sure how many people understand the deepness of this problem that is happening so close to us. I want to invite you to set up your own HIV recycling campaign, perhaps doing a medicine drive within your organization, telling your clients, telling the pharmacists, telling the HIV doctors to get involved. We've been doing this for 20 years, so we can help you set it up. You can write about it, announce it on your newsletters. We can send you support materials via, internet to help you to make this effective. But more importantly, we want to continue the communication with everybody that is listening now. We want to be able to have contact with you. I would like to hear from you after we finish this conversation. There's my email that I can send you. I'm sure we can send an email to everybody. But it's to continue this conversation. Perhaps you have ideas on how we can collect more medicine that we believe is being thrown away, and we take things for granted. So I'm going to close with that. I invite you to please be creative to get involved with A4AIDS. We're going to open a Q&A session now.
Thank you, Jesus. So we open the floor now, so you can write your questions in the chat box. There was a person that apparently was very surprised with the pictures that you were showing, and it says like he was asking if the pictures from the front cover was from Venezuela.
Oh yeah, that's a picture. Actually, we took it. That was in the newspaper. That's actually a picture, real picture.
It shows like it's very critical situation in Venezuela. Also, you mentioned that you wanted people to send donations to you. How can they do that?
Well, people can donate. If you have ARVs, if you can collect within your organization, if you can't organize any medical drive, you can actually mail the medicines to our office here in New York. If you don't have the resources, we can send you a prepaid label, and we'll pick it up any place in the United States. It's one of the UPS or any of those prepaid labels, so we can pick it up.
We have Tom Donahue asking if is the Venezuelan government in support of your efforts?
Well, Venezuela is going through one of the toughest dictatorship that we've seen in Latin America for many, many years. What makes this very difficult and very unique humanitarian crisis, and a humanitarian crisis that is different than others, is that this crisis was created by the government, and the government refused to accept that people are dying. So the answer is no, because the government won't accept that this is happening. This is one of the challenges that we have in front of us, and we've been quite successful to pass it through and get the things to the hands of the people that need it.
We have another question here from Alicia saying, what type of stigma does HIV have in Venezuela?
You know, this is a very interesting question because the stigma, HIV stigma is still everywhere. And I think because the humanitarian crisis is so deep, the economic crisis is so dire, that everybody is in survival mode. So I'm not sure if stigma is playing a role right now. I'm sure it is playing. But the truth is, people are not getting rejected to get treatment because they're HIV positive. It's just there's nothing for them once they go to the hospital. But there's nothing for anybody. To give you an example, if you're going to get surgery in a public hospital, you need to bring your own syringes. You need to bring your own sheets to the bed. You need to bring your own antibiotics. You need to bring whatever you need to bring it with you. So we don't see stigma. It's because everybody's been rejected. We will be able to measure stigma once the health system go back to normal.
And we have another question from Tom. Do you know any Venezuelans living with HIV in the United States that are facing deportation at this moment?
Well, I heard, yes. Actually, I got an email. We support them. And there's one in the paper I read in the Miami Herald. And there's some of them. We can help writing letters if you know a Venezuelan who's facing deportation. I believe that's the question.
Yeah, and Tom also suggests that we need to put pressure on the United States legislators and the U.S. ICE not to deport people living with HIV to Venezuela.
Absolutely, and I think this is very, very important. There's thousands of Venezuelans asking for asylum, and within those thousands, there's a lot of people with HIV. I know there are people with HIV facing deportation, definitely, and we can help. If you know somebody who needs letter of support, I mean, we have AIDS Venezuela. We can write a letter. We have a lot of material that can help.
Jill Westerberg is saying, you mentioned monthly shipments or ARVs that you send to Venezuela. Is the government putting the same barriers on the entry of those monthly shipments as they are in the additional shipments?
Oh, yeah. Venezuelans would put anything that they think is humanitarian aid, and they will stop it and make it very difficult for you. The thing is that we already have a system in place. We have a system in place that we know how to get it and to Venezuela. What we're doing is we're increasing the size of the shipment, but we have our own way to get it, and we've been doing it for many years, and that's not involved the Venezuelan government.
Javier from AHF, AIDS Healthcare Foundation, is asking for a list of drop-out locations in New York City. They want to help?
Sure. I mean, you can email us. I mean, it's GMAC, Housing Works. You can have one we can bring a box. And you don't need a drop-off box at your location to do a medicine drive. We can help you set it up, but you can email us after. I mean, we'd love to continue the conversation, and I can put you in contact with the people in charge of the recycling program.
Again, Tom says he would like to help again. And Jill, the organization in Queens represents 10 HIV-positive Venezuelans in immigration proceedings, and they will be in touch with you to help them out.
Well, that's fantastic. Is anyone on the phone? Can people on the phone ask questions?
Yes. So I'm going to unmute everybody so people can talk. Also, when I do that, please, if you're not talking, mute your phones and raise your hand to talk.
The conference has been unmuted. The conference has been unmuted. The conference has been unmuted. The conference has been unmuted.
Here, what type of hope is for things to change in Venezuela? What needs to happen in order to start changing the trajectory of it?
Well, this is a political question, and honestly, the way it is now, it doesn't seem to be any way out. But history has taught us that non-evil regime has lasted. So I don't know the answer of it. I just know it will be out. We just don't know when. At this point, all we can do is to try to save as many lives as possible in Venezuela, and that's my invitation to all of you to join us to help saving life in Venezuela.
I have a question. It's like I was reading about the situation in Venezuela, and it's very important what you're doing. Is there anything else that you've been doing in Venezuela to prevent people from getting HIV? That condoms is impossible to get. It's very expensive to get condoms, and it's different to here where you can.
Yeah, well, in Venezuela, there's no condom. There's no prevention method. Absolutely nothing. The average time for you to get a CD4 or viral load test is 2 years. And we just sent 50,000 condoms to an organization, a partner organization in Margarita Islands, Stop HIV, and they will distribute it among 8 organizations. And it got there. It arrived. It arrived yesterday. And so we would love to. What we're trying to do is trying to get the new technology where clinics around Venezuela can have their own CD4 and viral load test machine. As of right now, the government centralizes all the lab work, and it's really chaotic. And it is on private donation, private labs that you can get a CD4 viral load, but it's inaccessible. I mean, a viral load, if minimum wage is 800,000 bolivares a month, which is $4 or $3 and change, a test costs 1 million bolivares. So very, very few people can actually get a private test, HIV, CD4 and viral load test. There's very few HIV tests. I mean, we're working on getting HIV tests. That's part of the work we have done. We sent 11,000 HIV tests, rapid tests, and with our partners in Caracas, and as pregnant women, again, is when you put a tragedy with layers, we believe prevent mother-to-child transmission has become priority.
I'm here. What do you see happening in the next 5 years in Venezuela? Is it being a failed state? What can the U.S. do to help short term to the long term, especially for HIV?
In Venezuela is not on the brink of being a failed state. Venezuela is a failed state. Venezuela is organized crime took over a country. This is the dream of the biggest mafias in history. It's happening in Venezuela. So it's already a failed state. And failed state have zero interest on healthcare, and obviously the crisis with such a high economic crisis is a high health crisis. But it's already a failed state. What's happening? I don't know. Again, I'm not focused on the political component. We focus on the humanitarian component. This is something that we're going to watch the news. We're going to see something would happen, and that's just my hope.
Anybody else have a question? You are all on mute. You can ask questions on the phone or on the computer if you want, or you can write it like you've been doing. Anybody?
Well, I can, yeah.
The conference has been muted. The conference has been muted. The conference has been muted.
Okay, Javier is providing some information here. The AIDS Healthcare Foundation had 3 meetings already with the Venezuelan government to offer free medical, free labs, and free meds, and government has declined to accept any AIDS.
Well, Javier, thank you for proving my point. This is exactly why you need to work with A4AIDS. I would love to know what you can offer. We at A4AIDS, we were able to open with the United Nations warehouse in Panama, where the humanitarian warehouses of the UN are. That's with the World Food Program, and this is large donations. That's different. That my request to most of the people here, and we have the way and the means to send it to Venezuela. Whatever you have, I'll be happy to talk to you, or to whoever was the one who talked to the Venezuelan government. It won't happen. The Venezuelan government won't ever accept any support, because by accepting support, they will accept that they failed.
Javier says at the end of the conference we will continue conversation. He will contact you.
Great, thank you, Javier.
Yeah,
Looking forward to hear from you.
And I understand by Lisa here that everybody who has been in this conference and everybody who's signed to register for this will receive an email, and that email you receive all the information, the A4As. You can contact them directly. So anybody else, any question?
Well, also, if you have suggestion, I mean, if you don't, I believe the people on the phone, if you're shy, you don't want to talk right now, I would love to hear from you once we finish. I hope you can take on this information, and not only for you, but to the people that you know, to your organization. Bring it to your executive director. Bring it to the CEO of the organization. If you're not related, if you're just a member, just bring it to the next support group. Bring it to the next group. Talk to among your friends, because we can do something. We all have the power. Again, if you all go home right now, you check your medicine room, believe me, you will find something that you have sitting there for months and has not been expired, and whatever you have in that medicine cabinet, we can send to the people in Venezuela tomorrow. So I want you to keep this in mind. Talk about it. Write about it. If you have questions, if you have doubts to whatever I'm saying right now, you can contact me. You know, we can have this conversation among your organization.
There's one more question here for Ernesto Hernandez. I know there is a huge immigration coming out of Venezuela. Do you know where are the hotspots? Where are they mostly going here in the U.S.?
Listen, Venezuelans never have left the country. We estimate that 4 million Venezuelans have left the country in the past 5 years, and 2 of them in the past year alone, 2 million people. Venezuela is a country with a population of 31 million people, so that's more than 10% of the population. And Venezuelans are mostly going to Latin America, to other Latin American countries, like Dominican Republic, Panama, Colombia, Peru, Ecuador, Chile, Argentina, Brazil. And those that can make it to the U.S., we see them in Miami, but we also seen a growing Venezuelan population in cities like New York, Chicago, L.A., San Francisco, even in places like Ohio, and where we never thought they could have. In Arkansas, there's a Venezuelan restaurant. So in Canada, there's Venezuelan places now. And we have, in the Middle East, there's Venezuelans. So there's Venezuelans all over the world.
There's information here from Javier. It says any HIV positive immigrant from Venezuela arriving to New York City can come to their pharmacy or call them at 718-637-2970. They will have with insurances, doctors, and meds, all free.
Wonderful. That's great. Thank you.
Tom, yes, he's asking about the recording of the webinar. Yes, it will be available in the next days. It will be posted probably by A4AIDS in the website or on the media. Any other question? It looks like we have covered all our questions, Jesus. Is there anything else you want to cover before we wrap up?
Well, I would, again, make a call in here and just continue the conversation. I think it's important. It would have been great to hear from the people on the phone, but I understand sometimes it's not the best place to ask. But I hope we can continue this conversation after we finish here. And I'm not sure what's the best way to give them my email address, and I will give you the team, A4A's team. I don't have it on my presentation, I don't believe. My bad. But I will, we can send an email. We'll send an email to everybody that registered with my information.
We're going to download the list of people who attended, people who registered, and we will send a massive email with the information with your contact. And also you have a website that they can go to, which is
A4A's.org.
Okay, you can
spell it out. A4A's.org. Very easy. We also on Facebook, A4A's, Facebook/A4A's. We are Instagram at A4A's. We are on Twitter at A4A's INTL, like international A4A's INTL. And you can follow us, and you can ask questions. You can send us an email. My email is my first initial J, my last name Jaguais at A4A's.org. It's very easy. JAGUAIS at A4A's.org. You see it on the presentation here. If you have it on the screen, it's JAGUAIS at A4A's.org.
Okay, so great. Thank you, everyone. We appreciate you being here. And don't forget what...
You're welcome, Robert. Glad you're here.
Jesus suggested please send your medications, tell your friends, your families, everybody who you know who is HIV positive and has changed medications. Do not throw the medications and find a way to make them to A4A so they can send them to people who really need it in Venezuela. Also, for those who don't know, A4A not only helps Venezuela, helps a lot of countries. I know the same medications all over the country, all over the world.
Yeah, that's a good point. Let me wrap this up because we happen to be dealing with Venezuela. I always said we've been doing this for so many years. We have helped so many countries. We work with the Libya crisis. We send medicines to South Sudan. When we have worked in many places, we send medicines to 43 countries worldwide. This just happens to be in the country that I was born. But we at A4A, we've been doing this way before this crisis started. This is just coincidence. It just happens that I'm from Venezuela.
Thank you, Jesus. Thanks again for joining us today, and we will see you all next time.